package of that report, which we said Nigeria is set to take a major step in the fight against HIV and AIDS, as the federal government announces plans to roll out a new long-acting prevention injection aimed at reducing new infections and improving treatment outcomes.
The drug known as lenacapavir is a breakthrough in HIV prevention. Unlike existing daily oral medications, it is administered just once every 6 months, offering a more convenient option, especially for high-risk populations who struggle with adherence. Speaking in Abuja, the Minister of State for Health and Social Welfare, Isaac Salako, said the initiative reflects Nigerian commitment to ending HIV/AIDS as public health threat by the year 2030. According to him, the government remains committed to a comprehensive approach that prioritizes prevention, treatment, and care services across the country. Nigeria has been selected by the Global Fund as one of the 9 early adopter countries for the rollout of the injectable drug, with implementation initially expected to have begun in January 2026. At first, 52,000 doses have already been arrived in Nigeria, while nearly 180,000 doses are projected to arrive by 2028. The first phase would cover 8 states, including Anambra, Ebonyi, Kwara, Akwa Ibom, Cross River, and Benue State, as well as the Federal Capital Territory. Health experts say the introduction of lenacapavir could be a game changer, particularly in addressing one of the biggest challenges in HIV prevention: consistent use of daily medication. Nigeria currently has the second largest HIV burden in the world, with an estimated 1.9 million people living with the virus. Although treatment outcomes have improved significantly, prevention remains a major concern. Recent figures show that 93% of people living with HIV know their status, 99% of those diagnosed are on treatment, and 95% have achieved viral suppression. However, the country still records about 48,000 new infections each year. Health authorities warn that without stronger prevention strategies, new infections could continue to strain already limited healthcare resources. Meanwhile, the federal government says it is stepping up domestic funding for HIV, tuberculosis, and malaria programs, with a commitment of $346 million in 2026. Officials say this marks a shift away from heavy reliance on donor funding towards a more sustainable, locally driven response. Global health partners, including UNAIDS, have welcomed the rollout, but stress that more work is needed to close prevention gaps and reach vulnerable populations. If successfully implemented and expanded nationwide, experts say the new injectable prevention could play a critical role in reducing new infections and moving Nigeria closer to its goal of 0 new HIV cases by 2030. Ogie Ihimekmen, AIT News, Abuja.
Another major shift in Nigerian politics occurs as